I have no conflicts of interest, so I'm going to move on. This is the McVenture machine in my office, one of my rooms. Again, foil. I'm going to focus, first of all, on the other indications of TMS. So basically, TMS is transcranial magnetic stimulation. Usually what we apply in the clinical field is repetitive transcranial magnetic stimulation. I'm going to use the term TMS to refer to repetitive transcranial magnetic stimulation for ease. There are many different applications other than depression, unipolar or bipolar depression, since the early 2000s. Mania, for example, obsessive compulsive disorder, post-traumatic stress disorder, panic disorder, even generalized anxiety disorder, schizophrenia, auditory hallucinations and negative symptoms, eating disorders, different addictions, depersonalization disorder, autism, and Alzheimer's disease. As far as mania is concerned, there have been very, very few studies. All studies were open studies and included a very limited number of patients. The first study was done in 1998 by Grisaru, and it was basically comparing high-frequency rTMS over the right or the left dorsolateral prefrontal cortex. You may know that in mood disorders, there is a laterality of frontality of activity in the frontal lobes. Basically, in depression, the majority of cases, we have hypofrontality over the left and hyperfrontality over the right side, which means that by using high frequency over the left side, we increase the activity of the hyperfrontal area. And with low frequency of the right side, we decrease the activity of the hyperfrontal area. In mania, it's just the opposite. So we will use basically high frequency of the right dorsolateral prefrontal cortex because of its hypofrontality in hypomania or in mania. Patients responded significantly to high frequency right dorsolateral prefrontal cortex. Another follow-up study tried to compare sham and active treatment, but sham and active treatment were as effective. 3 other studies have actually used either 10 or 20 hertz rTMS over the right dorsolateral prefrontal cortex in patients mostly on the treatment, and they had pretty good results. Obsessive compulsive disorder is a disorder that is chronic, that affects 2 to 4% of the population, is characterized by recurrent, intrusive, unmanageable thoughts, obsessions, leading to compulsions or rituals that can be mental or behavioral. Initial studies were open studies and focused on the supplementary motor area with low frequency rTMS. They had some good results. The further studies basically chose many different areas like the supplementary motor area, the pre-supplementary motor area, the left dorsolateral prefrontal cortex, the bilateral DLPFC, and the right dorsolateral prefrontal cortex, excluding the OFC. There was only 1 or 2 studies that showed some improvement with the orbitofrontal cortex. But more and more, many studies showed that low frequency rTMS over the right dorsolateral prefrontal cortex can actually improve the symptoms of PTSD, including re-experiencing avoidance, fears, as well as some symptoms of depression, mostly when the person reads or thinks about a traumatic event, whereas high frequency rTMS over the right dorsolateral prefrontal cortex may not be that effective.